Good evening to you all, and thank you for the invitation. And as was already, As was already explained, there are many advantages from the composite carbon fibers and PEEK implants, and these main advantages can be easily transferred to orthopedic oncology. And for example, from the biomechanical point of view, as was previously said in the former presentation, elastic deformation, Young modulus, is quite close. It's very similar to the one of the cortical bone. And this represents an advantage also in orthopedic oncology. In some condition, like impending fracture or pathological fracture, because in this condition, the nail should have a similar modular of elasticity because it should support the bone, and the load should be similar to the one supported by physiologically by the bone. And from a radiological point of view, we see the advantages of having a radiolucent, radiotransparent implant, because we can evaluate the healing process or, unfortunately, the progression of the disease. And so we can see and monitor the progression of the osteolysis, and we can just intervene at the proper time with the right solution. And then we can also monitor the progression of the lysis under radiotherapy treatment. And also in some benign lesions, we can also show the healing of the bone, while we can see the integration of the bone graft. And from a radiotherapeutic point of view, there are also some advantages. And for example, the stability of the implant, because this implant is stable and did not degrade until cumulative doses of 10-15 megagray. And if we consider that the maximum doses of radiotherapy are around 40 or 70 grays, we cannot see phenomenon like cross-linking or degradation of the material. And we can consider that usually for metastatic disease, the usual dose is around 8 or 10 grays. So it's stable and long-lasting. Also because we are seeing a lot of long-surviving patients. Also metastatic patients are not patients destined to palliative care and destined to survive only a couple of months. We can see some people with metastatic disease surviving 10, 20 years. And also, carbon fiber PEEK does not have refractory or dispersive effects like titanium. And so we have a better imaging, but it's not just to have a better X-ray and say, oh, what a beautiful result. It's just because when we are planning radiotherapy, we need to have a more precise planning. And so if we have a CT scan with no scattering, we will deliver a better radiotherapy on our patients. And what we are aiming to is to change the doses of radiotherapy. But maybe it's too early because we have to change the mind of radiotherapists. And we are for sure delivering a higher dose in the lesion because of the better planning. But we will see it later. In our experience, since 2013, we have implanted 29 nails, 3 distal femoral plates, and 1 straight plate, 2 proximal humeral plates, and 12 spine devices, all in oncologic patients. And the main advantages from radiotherapy. As we said, more accurate dose planning, no backscattering is observed, no phenomena like attenuation or reflection, and less of tissue damage. And we will see later why. And then a more accurate follow-up. And so we can monitor over time the lesion, and we can monitor the effect, the positive and the negative effect of radiotherapy. And we can also evaluate earlier local recurrence of a relapse of disease. And as was previously said, also our radiologist was astonished from the first implant, especially in the spine surgery, and say, "Oh, what did you use? I can see everything." And so there are also funny radiologic reports. There is an unusual scar between the dura and, well, it is something that could be normal if you do a spinal decompression and you can see a little bit of scar among the dura. And in this theoric model of Monte Carlo simulation, we can see that the curves of steel, titanium, and carbon are different. And we will see later what does it mean. And also this dose distance graph show different curves of carbon comparing to steel and titanium. And this is what it means. It means that at the entrance point, the dose, the difference between the dose at the entrance and the exit point is almost the same with carbon. If we consider a thickness of 1, 3, or 6 millimeters. But if we consider steel or titanium, there is a big retention of dose. And this dose is going in the surrounding tissues. And so it is all pathological effect for surrounding tissue that no need any radiation. So if we plan correctly radiotherapy, we will deliver all the dose where we want, so in the bone or in the surrounding tissue. And we will not irradiate all the arm, the skin, the subcutaneous tissue, the nerves, the vessels. In Italy, we had a multicentric study between the most famous oncologic center in Italy, and we collected all the cases of pathological fracture or impending fracture of the long bones treated with carbon fiber and PEEK implants. And this study was directed and coordinated by Dr. Piccioli in Rome, and was performed under the direction of the musculoskeletal metastasis group of CIOT Society. And we study mainly humerus, femur, and tibia lesions. And the results are undergoing publication very soon. And we can resume that we did not observe any major complication from the implant. And the radiotherapy was performed in a single reference center for each group. And the preliminary results show that there is a better targeting of radiotherapy, and there are better results in local control of the disease. Because if you can see that this is a scout of a CT scan, and you can see the implant and the lesion, you can deliver perfectly radiotherapy on it. And this means that you will deliver 100% of the radiotherapy you want to deliver in the lesion and not in the surrounding tissue. From the literature, some case reports were published, and the previous study from Sloan Kettering already cited. And the importance of carbon fiber implants in radiotherapy, we have minimal perturbation effects on radiotherapy dose distribution. So, as we said, low toxicity in the surrounding tissues. And also from the mechanical point of view, it's very interesting. The study on finite element analysis showed that micromovement could be useful for the callus formation. And also in general traumatology, we observe better results comparing carbon fiber with conventional titanium alloy nail. And this can be an advantage in oncologic trauma too. And just I would like to show 2 quick cases. And this is a little boy, 7 years old. 3 years ago, we have a diagnosis of fibrous dysplasia. Unfortunately, parents forgot to perform a follow-up. And so, after 2 years, the little boy came with this pathological fracture. And the fracture was treated with curettage, bone grafting, and carbon fiber peak plate. And as you can see, we can monitor perfectly the bone healing and the integration of bone graft. And this is very important for a little child. And this is a very complex case. In 2010, this little girl, 5 years old, she had a Ewing sarcoma. She had all the chemotherapy, and we resected almost all the femoral shaft, and we treated it with a long allograft and a free fibular graft within it, with following the Capanna technique. And after 2 years, we can see that the bone is almost healed, and the small fibula is alive inside the bone. But we already tried to correct the deformation which was developing in the femur. And you can see that you cannot evaluate perfectly the bone. And the deformation went on. And so we decided to change something. And as we removed the plate, as we remove the plate, you can see that deformation is quite important, but there is some bone alive, and you can consider that this is all allograft, so that bone. And even if the girl has no pain at all, she was doing everything, and she fell down from a tree, and she broke here. And we made a mistake. We trusted on this bone, and we put on a short plate. And unfortunately, this plate was too short, and we had a fracture here. And we didn't know how to manage with this fracture, because it is half dead bone, half alive bone. And so we decided to change this plate and completely change our point of view. And so we removed everything, and we put a carbon fiber implant so we could monitor the evolution of the healing process. We put a strut graft on the other side just to help the bone. And now we can monitor better the evolution of the fracture, which is clinically healed because the girl is doing everything. And we are very happy for the result and for the possibility to monitor. And we cannot forget that this is a Ewing sarcoma, so we are still under the period of follow-up. So we have to monitor the fracture healing, but also we have to monitor that the disease does not come back. And coming back from the importance of follow-up and radiotherapy, we should also consider that from recent study, there is the importance of preventive synthesis of the bone if we remove all the periosteum in soft tissue sarcomas. If we are going to do radiotherapy after a soft tissue sarcoma removal and we remove all the periosteum, the bone will be too weak and we will have a fracture in a couple of years. So we should prevent this fracture. And if we put an implant, a titanium implant, we will not be able to do an accurate follow-up afterwards. And we need to do magnetic resonance or ultrasound scan to monitor a soft tissue sarcoma. So the fracture is going on. And I would like to thank you all for the attention.